Welcome to the first part of the stroke overview series. In this video, I'll be discussing the types, causes, and symptoms of stroke. To fully understand stroke, it is important to know that there are two main types of strokes. The most common type, ischemic stroke, accounts for about 87% of all strokes. The other 13% are hemorrhagic strokes. Ischemic strokes can further be subdivided into two types. The first being thrombotic stroke, which is caused by a thrombus or a blood clot that develops in the artery supplying blood to the brain. This type of stroke is usually seen in older patients, especially those with diabetes, high cholesterol, or a condition known as atherosclerosis, which is caused by a buildup of fat and lipids inside the walls of blood vessels. The second type of ischemic stroke is known as embolic stroke, and these are caused by a blood clot or plaque debris that develops elsewhere in the body and then travels to one of the blood vessels in the brain through the bloodstream. In this model, we see plaque that is built up on the wall of an artery break apart, and this debris will continue to travel through the bloodstream until it reaches a part that is too narrow to go through, leading to blood circulation being cut off. The other main type of stroke, which are a lot less common, are hemorrhagic strokes. There are two subtypes of hemorrhagic strokes as well, the first being intracerebral hemorrhagic stroke. This happens when bleeding is from the blood vessels within the brain, and intracerebral hemorrhage is usually caused by high blood pressure. Bleeding occurs suddenly and rapidly, and there are usually no warning signs, and bleeding can be severe enough to cause coma or even death. The second subtype of hemorrhagic stroke is subarachnoid hemorrhagic stroke. This occurs when there is bleeding in the space that surrounds the brain. Most often, it occurs when an aneurysm or a bulging, weakened area in the wall of a blood cell that is on the surface of the brain bursts and leaks. The blood then builds up around the brain and inside the skull, increasing pressure on the brain. This can cause brain cell damage, lifelong complications, and disabilities. Next are the causes of stroke. As mentioned before, strokes usually occur in one of two ways, either from the blockage of an artery cutting off blood flow to the brain, or when a blood vessel in the brain ruptures. However, there are many risk factors that can lead to a stroke. There are both non-modifiable or uncontrollable risk factors, as well as modifiable or controllable risk factors. The non-modifiable risk factors of stroke include age, where being over 55 years of age increases your risk and doubles with each new decade. Race, because African Americans and more recently Hispanics tend to have a greater incidence of high blood pressure. Gender, because stroke occurs more often in men, but more women than men die from stroke. And lastly, genetics, because the chance of stroke is greater in people with a family history of it. The biggest modifiable risk factors for both strokes are high blood pressure, smoking, diabetes, high or low levels of cholesterol, being overweight or obese, using illegal drugs such as cocaine, a high alcohol consumption, a lack of sleep, and certain blood disorders such as sickle cell disease. Risk factors for ischemic stroke specifically include having atherosclerosis, atrial fibrillation, which is a type of irregular heartbeat, or carotid artery disease. Risk factors for hemorrhagic stroke specifically include having a previous brain aneurysm, high levels of stress and anxiety, using blood-thinning medications such as warfarin, or having arteriovenous malformations, or AVMs, where blood vessels form in a tangled web. Moving on, there are numerous symptoms of stroke, and they can be split into three main categories. The first category includes symptoms that affect movement, and these are numbness, weakness, or paralysis in the face, arm, or leg, particularly on one side of the body, trouble walking, and face drooping. The second category is vision problems in one or both eyes, including blurred or blackened vision, or seeing double vision. And the third category is general symptoms, which include sudden severe headache, or speech problems, including difficulty speaking or understanding speech. The acronym FAST is a good way to remember the symptoms of a stroke. It stands for face drooping, arm weakness, speech difficulty, and time to call 911. The longer a stroke goes untreated, the greater chance for brain damage, disability, or even death, so it is extremely important to contact emergency services as soon as you notice symptoms.